from the studios of WCNY. This is an Election 2012 debate. Tonight, a debate with the candidates for New York's 24th Congressional District. Here are Susan Arbetter and Matt Mulcahy.
Good evening from the studios of WCNY in Syracuse. We welcome you to this Election 2012 debate.
Tonight's debate is being produced by WCNY Public Television and CNY Central in Syracuse. I'm Matt Mulcahy, Managing Editor and Anchor for CNY Central.
I'm Susan Arbetter, News and Public Affairs Director for WCNY and host of the Capitol Press Room. This evening, we will hear the candidates for the 24th Congressional District seat debate the issues together for the first time.
We welcome the candidates to our debate tonight. Democratic Party candidate Dan Maffei, Green Party candidate Ursula Rosum, and the Republican candidate and the incumbent, Representative Anne-Marie Buerkle. Welcome to everyone.
Thank you. Here are the rules for our debate. Questions will be asked by Matt and me. Each candidate will have 60 seconds to provide an answer. After the third candidate to respond finishes, each candidate will then have the opportunity to provide a 30-second rebuttal.
Susan and I may then ask some follow-up questions. Candidates will deliver opening and closing statements, and that order was determined by a draw of straws earlier. So we begin with opening remarks tonight from Dan Maffei. Dan.
Well, thank you, Matt. Thank you, Susan, and thank WCNY and CNY Central and WXXI all for co-sponsoring this debate. Now, I'm Dan Maffei, and I was born and raised in Syracuse, in the city. Went to public schools, graduated from Nottingham High School, and then in college I worked at my family's small business. It was an electroplating factory on Burnett Avenue. I've seen the middle class struggle firsthand. I think in Central New York we have what it takes. We have what it takes to make it, but we just need a fair shot. That means we have to balance the budget, but we have to balance it the right way, the way President Clinton did when he was in office. We need to make sure that we cut tax breaks for companies that move jobs overseas. We need to take oil company subsidies and get rid of them. The oil companies are making enough money. And when our troops and our treasure is over in Afghanistan, nation building there, we need to bring our troops home, and we need to, instead of building bridges and schools in Afghanistan, build bridges and schools here. And finally, we absolutely need to make sure Social Security and Medicare are saved not just for this generation, but for future generations. We can make our economy grow. We can make the smart investments in education and research, and particularly in transportation infrastructure that will help Central New York create jobs. We can do it. We have what it takes here in Central New York. We just have to go and do it.
Anne-Marie Buerkle.
Thank you very much, Matt and Susan, for this opportunity and for hosting this very important discussion. 2 years ago, or 3 years ago now, when I decided to run for Congress, it was because I believed that upstate New York had lost its voice in Washington. And in fact, our campaign slogan was "Be Heard, Back Buerkle." And over the course of the last 22 months, we've hosted over 40 town halls, 60 mobile town hall units. We've talked to hundreds of people in the district, business owners, farmers, hospitals, physicians, our seniors, our women's groups. And you know what they did? They confirmed for me my instincts were correct. That Dan Maffei's policies and the things he voted for have hurt real people here in upstate New York. They've hurt our economy. And so when I hear from St. Joe's and they're going to have to pay a $3 million penalty because of a provision within the Affordable Care Act, or Welsh Allen has to pay a 2.3% tax on its excise on its small medical devices, or that a company like Tracy's, because of the Affordable Care Act, has to pay a 3.8% tax on its passive incomes, I begin to see that upstate New York cannot afford to go back to Dan Maffei's policy. We need policies that bring us forward, that create jobs in the economy in upstate New York. I'm so glad to be here, and I look forward to your questions and to the robust debate that I'm sure we're going to have. Thank you.
And Ursula Rosum.
Yes, good evening. I'm Ursula Rosum. I'm the Green Party candidate for Congress this year. And my family came to Syracuse in the 1980s. They came from Poland, where they had been solidarity activists. They fought the Nazis in the 1940s and the communists after World War II. And they came to the United States believing that this is a country where if you work hard, you can have a good life for your family. And unfortunately, that American dream is just too far out of reach for most people. We're seeing skyrocketing unemployment, strangling debt for too many people. That's why I support positive, progressive solutions to these crises. I support a public jobs program like we did during the WPA to get people back to work as soon as possible. I support Medicare for all so that healthcare can be a human right and not a pay or die commodity. I'm running because my opponents represent the failed policies of the major corporate-funded parties. They get to Washington and they're busy dialing for dollars rather than solving problems. So I'm here to offer progressive solutions because real solutions can't wait.
Thank you, Ursula Roseman. Thank you to all of our candidates. It's hard to be a candidate and it's hard to serve the people, and we appreciate all of you being here. So the first question is about the fiscal cliff. A fiscal cliff awaits this nation as the Bush tax cuts and the sequestration cuts imposed to break the impasse over the debt limit crisis in August of 2011 both come due in December. Both presidential candidates are recommending that we cut the deficit, yet a partisan impasse remains. Knowing that 75% of voters told an NBC Wall Street Journal poll this week that they want Congress to find a compromise and end that impasse, what are you willing to offer on taxes and spending cuts to forge a deficit reduction compromise? Or do you think compromise will undermine your commitment to voters? And we go to Anne Marie Buerkle first.
Thank you very much, and you are absolutely right. The end of this year will signal the largest tax increase, and it will affect 90% of the American people. So we have to do something that will avoid that fiscal cliff. I have voted for the Simpson-Bowles budget. I think that there is a lot of opportunity and a lot of room for us to make compromises and to reach across the aisle. I was one of 38 members of the House who voted for Simpson-Bowles. It was a bipartisan effort. It was the President's own commission who put forth this plan. We are really on an, I believe, immorally, what we're doing to our kids and to the future of this country is immoral. We've got to stop spending, and we cannot address this debt and deficit issue by increasing taxes. We have to put a pro-growth economic agenda in place. We can't cut our way out of this debt. We can't tax our way out of this debt. What we need to do is to send a message to our businesses, to our job creators, that you're the solution to this problem. You're not the problem.
Ursula Roseman.
I think the fiscal cliff presents us with a choice. We can either balance the budget by cutting the kinds of spending that provides programs that working people rely on, or we can go in a new direction. So I would support progressive tax reforms to balance the budget and to address the deficit. And when Anne Marie Buerkle says we can't cut and spend our way out of this crisis, she has come out in favor of cutting things like food stamps, for example. So I'm not sure what she means when she says we can't cut our way out of this. I support progressive taxes like what we had during the Eisenhower era, where the rich pay their taxes. And today, we've seen in the past 40 years, working people's incomes stagnate. So I favor graduated marginal income tax rates on the top 10% of income tax earners. And I also support progressive corporate tax rates. I would support cutting the military budget by 50%, ending corporate tax loopholes and giveaways to the fossil fuel industry, and also cutting the drug war.
Thank you, Ursula Roseman. Dan Maffei.
Well, as I said, I do think we need to balance the budget, but we need to do it in the right way, not in the backs of seniors, as Anne Marie Buerkle would when she voted to raise the retirement age of Social Security, and not in the backs of our middle class. The funny thing about the budgets that are going on in Washington is that they're either one side or the other. They do try to either tax our way out or cut our way out. The question was about compromise, and I think that's one of the central things that is lacking in our representation today. Anne Marie Buerkle and the Tea Party faction have kept the Congress from ever finding agreement on anything. Sure, she talks a lot about reducing debt, but the debt hasn't been reduced one penny since she's been in office. Why? Because her and her faction won't work with President Obama. If he compromises, they say, oh no, and they move their position. We do need to work together across the aisle, Democrats, Republicans, Independents. Together, we can find a solution to this problem.
Thank you, Dan Maffei. A follow-up question for each of you, and we'll begin with Anne Marie Buerkle. According to the State Budget Crisis Task Force, which was a bipartisan task force led by former Lieutenant Governor Richard Ravitch and former Fed Chairman Paul Volcker, federal deficit reduction is threatening state economies and budgets because states depend on federal grants for 32% of their revenue. Knowing that the cuts flow downhill from the federal government to the state government to the local government, and knowing that the city of Syracuse and many other municipalities in New York may soon face financial insolvency, what would it take for you to consider either voting to raise taxes or voting to raise the debt ceiling if it would help the city?
I think that the burdens that our city faces and many of our counties and our state faces because of the federal government, because of the federal mandates that the government places on them, whether it's with education or Medicaid, that is a shared responsibility, and the more patients who are receiving Medicaid, the higher the responsibility is for the municipalities, and that adds to their debt. So a lot of the problems that our city faces are because of the burdens that the federal government places on them. But I want to go back to this budget issue and the willingness to compromise. Simpson Bowles was a good compromise. It was a place to start the discussion about how we're going to get this country back on a fiscally sound course. That was bipartisan. That was the President's Commission, and it doesn't fit Dan Maffei's narrative. He wants to call me a Tea Party Republican when in fact I was only one of 38 in the House of Representatives who voted for Simpson Bowles, who was willing to stand up to my leadership and say, there's a better way. Let's do this bipartisan approach. Let's do what's best for the people of this country.
Thank you. Ursula Rosem, a follow-up for you. If there is a 10% across-the-board cut in all federal grants, New York would lose more than $6 billion. According to the Ravitch and Volker report, states' interests should be on the table when federal reductions are being debated, yet there is no standing arrangement in the federal government for analyzing the overall impacts of federal actions on states. If you win this election, do you promise to support a mechanism for consulting with states about any upcoming federal changes and their impact on state and local governments?
Of course, I think consulting with people affected by decision is key to legislation, and no one wants bureaucrats in Washington making decisions that are going to be affecting them. And that's why I support progressive taxation like what we had during the Eisenhower times, the time when we had a balanced budget and we weren't talking about these kinds of deficits. Dan Maffei talks about compromise, and I think compromise is important, but it's also important to take a position and not compromise before the fights even started. And he said that he would allow the Bush tax cuts to expire for those making over $1 million, which is even more extreme than what President Obama has proposed, which is letting them expire for those over $250,000. And we cannot balance the budget that way. That only raises about 5% of what we need to cover the deficit.
Thank you, Ursula Rosem. Continuing with follow-ups, Dan Maffei, counties are also crying out for relief from the burden of Medicaid costs. The new health care law that you support will increase the cost of Medicaid even further. How do you justify that on top of the fiscal crisis that municipalities are facing due in part to unfunded mandates like pension and health care costs?
I do think we need to combat unfunded mandates, but the other thing that we must do is work very closely with our counties. When I was in office, I worked very closely with County Executive Joni Mahoney, make sure that we had excellent first responders on environmental issues, et cetera. I do think that it is important, though, that we do work together and compromise. I've been criticized for my position saying people who make over $1 million should go back to the Clinton-era rates. They were doing just fine then. One of my opponents calls that an extreme position. I want to know if Anne Marie Burkle would accept that position, because if you don't do that, if you're not willing to compromise there, where are you? And at what point will you stop holding tax cuts for small businesses and individual families hostage to tax cuts for millionaires and billionaires?
Well, certainly the big issue in this campaign and this economy has been jobs. All the polls show it. You've all talked about it a lot. And Ursula Rosem, we want to start with you on this issue. What will your legislative priorities be to increase jobs? What evidence do you have that those ideas will produce jobs? And for you specifically, do you have an idea outside of the public sector creating these jobs? How would you do it for also the private sector?
Sure, that's a really great and important question. And so my platform is modeled on what we call the Green New Deal, which is a program to put people back to work in public jobs, transitioning to a renewable energy economy, and also meeting community needs. And so yes, during the campaign I've been focusing on public jobs, and I would support legislation that's already in the House that's been presented by John Conyers, the 21st Century Full Employment and Training Act, that would put people back to work in public jobs along the lines of the WPA. And the benefits of a public jobs program would be that it puts money in the hands of working people that they can then go out and spend in their communities, which is a stimulus to the private economy. So I support a program to have direct government employment and that would have an effect on the private economy, because if people don't have money, they can't spend it at private business, so then private business doesn't really have an incentive to produce and hire.
Dan Maffei, what would your legislative priorities be, and what evidence do you have from your prior term in the House that some of these programs could work?
Well, we do need to balance the budget. I mean, there's no question about that. You cannot spend your way out of this, and you cannot cut your way out of this. But you need to balance the budget in the right way. And part of that means making sure that you do make key investments that will create jobs. Two areas. One, infrastructure, particularly transportation. Here in central New York, it's very, very difficult to even fly anywhere because you have to transfer in various cities. You may have to be at the airport extremely early in the morning, even to fly to another city on the East Coast. We need another discount airline. We can get it. And in the long run, we need high-speed rail. We need to put us back on the map, just as 200 years ago, our founders put us back on the map with the Erie Canal. The other area that I do think will increase business is research and education. We need to make sure that we have the workforce that can do the jobs necessary to do the future. This is why I think education needs to be a national priority, and why I think it's very, very important that we make sure that we have sufficient research funding. Even Mitt Romney says he would multiply the research funding we're doing by something like fivefold.
Thank you. Anne-Marie Buerkle, your legislative priorities to create jobs in the next couple of years.
Well, what I wouldn't do is vote for a stimulus like Dan Maffei did, that you spend $860 billion of taxpayer money and you keep unemployment remained high throughout the last 40 months. You know, in the Coolidge administration, JFK, Reagan, and Bush, they knew that you couldn't raise taxes, that tax breaks help the economy, and an economy as fragile as ours, that's very important to do that. In fact, Dan Maffei voted in 2010 to extend all of those current tax rates. What we have done is we repealed the Affordable Care Act, because we know here in this district how that Affordable Care Act is going to Welsh Allen, small medical device producers, Tracy Equipment, this tax on passive income, St. Joe's Upstate Medical Center is going to lose $18 million a year in Medicare disproportionate share reimbursements. It's going to hurt the economy, so I voted to repeal the Affordable Care Act, and beyond that, we voted for bipartisan support 3 free trade agreements that are going to really aid upstate New York in increasing the number of exports from our district.
Dan Maffei, we have time for rebuttal here. What are your thoughts regarding the Stimulus Act? Do you regret your vote on that?
Well, I think the Recovery Act was absolutely essential at the time. First of all, it had lots of tax cuts for small businesses and for individual families that were absolutely essential to those families. Secondly, it kept police on the streets. It kept our teachers from being laid off and our classrooms from blowing up in size. And it had firefighters. I mean, so we certainly had to do something. The thing that I'm really confused about is, okay, so that's bad, but then I did the right thing on the taxes apparently, but now some of the economy is starting to emerge, and it seems to be fine for millionaires and billionaires. I'm doing the wrong thing by asking them to pay their share, and yet we need to balance the budget, but where's the money going to come from? None of it adds up.
Ursula, your reaction to the Congresswoman's remarks about repealing Affordable Care Act, for example?
I think it would be immoral to repeal the Affordable Care Act at this point. There's too many good parts to it, and I think we need to be moving forward. And repealing it right now wouldn't get us to where we need to go, which is a Medicare for All system, which would make it actually much easier for employers to hire workers and to provide health care for them, because they would be paying a simple Medicare payroll tax, for example. And the provision of the Affordable Care Act with the tax on the medical exercise devices hasn't really proven to be true, because there should be an increased demand for medical devices under the Affordable Care Act. So I'm not really compelled by Representative Buerkle's arguments here.
Anne-Marie Buerkle, your chance to rebut.
Well, I think Welsh Allen telling us they're going to lay off 10% of their workforce is indicative of the Affordable Care Act, how it's going to affect jobs in the economy. You know, our largest employers in our district are, we call it EDS and MEDS hospitals, and the Affordable Care Act is going to dramatically impact Medicare reimbursements to our hospitals, to our physicians, along with sequestration. And if our hospitals aren't alive and well, you can have the most comprehensive health care plan in the world, but if you don't have hospitals and you don't have physicians who will treat these patients, then our health care system is going to fail miserably. And so I would say that you know, absolutely we need to repeal the Affordable Care Act for jobs and the economy's sake.
Further on jobs now, going back to Ursula Rosum here, didn't the Obama administration try something similar to your Jobs for All program with the stimulus package? You see some comparisons there, and how do you compare the two?
No, because the Obama administration's stimulus was not meant to be a permanent public jobs program, and the cost of those jobs were sky high. It cost almost $800 billion, yet the number of jobs created or saved were only 3 million. The numbers that we're talking about are similar, 800 billion, excuse me, but to create over 10 million jobs. And so direct public employment is a little bit different than giving tax breaks to companies to create jobs, because the job creators just aren't getting it done. They're not creating jobs.
And Dan Maffei, a follow-up on the jobs issue. Do you think that under, say, a second Obama administration, or should you return to Washington, could you create a more favorable tax environment for businesses or hospitals to grow so there could be more jobs?
Well, there's no question that tax reform would be very, very important, and I do think we need to lower rates, but get rid of a lot of the loopholes, particularly these corporate loopholes, the ones that ship jobs overseas. These do exist. Anne-Marie Buerkle has voted to continue them. She's also voted to continue the big tax breaks for oil companies. We can have a lot more equity in our tax code for businesses, for small businesses, as well as for individuals, so that's very important. I do think there's changes that need to be made in the Affordable Care Act. I'm opposed to the device tax. I worked with Welsh Allen to try to not have it in the first place. I do think we need to make those changes, but we're never going to make any changes if we're not willing to compromise.
And would repealing, Anne-Marie Buerkle, would repealing the Affordable Care Act affect jobs in any way, in a positive way? Do you see it affecting it in a negative way?
Oh, absolutely. You know, this country needs health care reform. We know that. Everyone knows that. This law.
But you're saying you're going to repeal it. So
I'm going to repeal it and put in place something that's going to be bipartisan. This Affordable Care Act was something the Democrats sat down and shoved it down the throat of the American people. Dan Maffei never came back and talked to the district and understood how it was going to impact our hospitals, our physicians. This Medicare, this Affordable Care Act cuts Medicare for our seniors by $700 billion. In our district alone, that means cuts of $1 billion for our seniors. This law was not well thought out. It was not bipartisan. It was a very partisan approach to health care reform.
Do you have another plan?
We have another plan in the House. Yes, we do.
Okay.
Maybe we can get to that with our follow-up question here. This is about Medicare. As the population ages, the current cost projections for Medicare are financially unsustainable for the nation. So which of the several floated plans out there to put Medicare on stronger financial footing do you support and why? And we're going to begin with Dan Maffei.
Well, it's extremely important that we save Medicare as a guaranteed benefit, the way it is now, not just for today's generation, but for future generations. Anne-Marie Buerkle says, if you're over 55, don't worry. There's some real reasons why you should worry, but she says don't worry. But if you're under 55, you better watch out, because she wants to change it. In fact, the Ryan budget she voted for makes it into a voucher program. Well, that's one way to handle it, but there are other ways. Medicare needs some adjustments, but fundamentally, it's a program that works. What doesn't work is the very, very high cost of health care. There's a lot more that we need to do to lower health care costs. Obamacare did start the process. It did start lowering health care costs. However, we need to do a lot more. One of the things that we're pioneering here in central New York is electronic medical records. Those are one way that we can avoid repetition of different tests and things like that. We can work with medical schools and physicians to make sure there's more primary care physicians. That will also lower medical costs. And we need to work together. There's a proposal by the family physicians to make a medical home. These are all ideas that will help lower medical costs and save Medicare.
Thank you, Dan Maffei. We're going to go now to Anne-Marie Buerkle.
Thank you. You know, of all of the distortions and the disingenuous advertising and ad campaigns that have gone on, it is Dan Maffei's position on Medicare. Dan Maffei and anyone who voted for the Affordable Care Act needs to take responsibility that they cut Medicare for our current seniors by $716 billion. That will dramatically affect the services that our hospitals and our physicians will be able to give to our seniors. Every senior out in the audience should be concerned about the law of the land, the Affordable Care Act that Dan Maffei voted for. You know, if you want to talk about lowering health care costs, you've got to have tort reform. This law does not include any. Dan talks about electronic medical records. He should be talking to the physicians here. And if you're a sole practitioner, the burden that electronic medical records put on your practice, this law was not well thought out. It didn't have the appropriate parties at the table. We can do better for the American people.
Thank you. Ursula Rosam.
We can do better for the American people, which is why I support a Medicare for All program. like has been proposed in Congress almost every year, most recently by John Conyers again, HR 676 is a Medicare for all legislation, and we shouldn't have Medicare the way it is. We need Medicare for all. And I think the Medicare for all would transfer the $560 billion that are right now going to the billing bureaucracy and the monopoly profits of drug companies to care. Because what we have right now is not a healthcare system. We have a sick care system that is focused on insurance company profits that only go up when they deny us care. And the best way to stabilize healthcare costs is to take those profits and put them into care with a Medicare for all system. I just want to talk about tort reform for just 1 second. I would suggest Anne Marie Burkle discuss tort reform with Senator DeFrancisco, who has said that tort reform is not a problem and that medical malpractice insurance only contributes very slightly to healthcare costs. With a Medicare for all system, we wouldn't even have to worry about tort reform because we would not be having lawsuits that would cover care into the future.
We have 30 seconds for you, Dan Maffei, to rebut.
Well, I think that it's important to, Anne Marie Burkle talks about the $7.6 billion. What that was it was cuts to insurance companies to provide services. It was cuts to private insurance companies to provide services that they had to provide anyway. It didn't cut any benefits. Now, this has been proven wrong and said wrong by the Post Standard. And the thing is, this is what President Clinton even mentioned in the Democratic Convention, because she voted for the same thing anyway. It's in the Ryan budget. The Ryan budget keeps these cuts. So when Anne Marie Burkle talks about, you know, we need to do it differently, how come she hasn't? She's been the Congresswoman for 2 years. Where's the change?
Anne Marie Burkle.
Well, let's be real clear. The Affordable Care Act in its current form cuts Medicare for our seniors by $700 billion. Dan, that's a cut of Medicare Advantage by $250 billion and $300 billion, and the CBO has estimated those cuts to be even more. That does not have to do cuts to insurance companies. Medicare is a federal program. It will be cuts to the services that our hospitals and our physicians can provide for our seniors. Those will be the cuts, and the impact on our seniors will be real. We're already hearing from our constituents saying that, you know, they can't find a physician who will treat Medicare patients. It's real, and it is a real consequence of this Affordable Care Act.
Ursula Rosem, 30-second rebuttal.
I think this disagreement over the Affordable Care Act and the constant debate over health care that leaves out Medicare for all is quite indicative of the dysfunction that we see in Washington, which is why we need new leadership, new progressive leadership. The Affordable Care Act is modeled after Romney Care in Massachusetts, and it was originally developed by insurance company executives with the company WellPoint. So what I want to hear from our representatives and from my fellow candidates right here is, how can we get to a Medicare for all system that provides health care as a human right and that will finally stabilize health care costs?